at the National Labor Organization, we did a meta-analysis looking at a variety of different academic studies to see whether people really benefited from insurance. These are rigorous studies that compared people who had insurance to people who didn't have insurance and how they coped when an insured event happened. And the vast majority of these studies found that the people who were insured were able to cope more effectively with the risk.
If you look at the Kenya experience with microinsurance in agriculture, it has really been significant, and I think it has protected the farmers and also provides seed for the next season, so it does really help. In our own territory, we're looking at microinsurance health, you're looking at funeral products, you're looking at family support products. These really help the farmers, and it also helps the vulnerable in having cover and access to insurance products, which is really key.
The Haiyan typhoon example from the Philippines is a pretty compelling one, and not just because the insurance and the microinsurance sectors responded so well to help people get back on their feet, but the fact that so much legwork had been done in the Philippines to create the right kind of environment where the sector even existed, so it was in a position to actually deliver for people in their hour of greatest needs.
The first time that I was involved in microinsurance or became aware of the concept even was when I was doing research in rural India in 2005, and I was talking to these women that were clearly living in poverty in a rural handloom cluster, and they were telling me about their experience with their family's life insurance policies, and I was amazed at the empowering effect that these insurance policies had on these women. They were very excited when they were telling me about all the benefits, such as should their husbands pass away, they wouldn't have to indebt themselves to pay for the cost of the funeral. And they would even get a small payout with which they could keep their children in school and wouldn't have to take them out of school to send them to work. And they were amazed that they could get all of this for a really small premium. And if you imagine that such a simple policy can have such an effect on the lives of these women, then just imagine what more complex insurance policies like health insurance or agricultural insurance can have.
I've been working with health mutuals in Congo, Kinshasa, and it's striking to see how people, by joining forces together, by forming a mutual together, that they can access health and health care on the moments they need, and not only when they have the funding for it or the money for it. And so this makes that they can go to see the doctor quicker, and so that they can also improve their health better, and that they're in better shape. And so that's a really remarkable impact that things like microinsurance and mutuals in particular can do.
So the vast majority of studies really found that people are better off if they're insured, and so it really creates a dynamic that says, you know, this is important. We need to make sure that more people have insurance, and because they're able to be better off because of it.